Hi, this is Henry A. Ventricle speaking, and you are watching a heart and kidney transplant surgery training tape. Now, the following is going to be graphic and is a completely real surgery. This is a documentary of a heart transplant operation on a patient named Bob. Now, the video you will be watching will be in my point of view using a GoPro, so that you get to see what it really looks like. Now, I have been called over on the telephone to do a heart transplant surgery. So I will be showing you all the steps that I did to save this patient. Now we're here in the operating room. Now the first step, we have here some lights to help us see better. So we'll just place the lights to our liking so that we can see his chest cavity better. Now, as you can see, the chest cavity has already been cut open by our nurse. And this is good. It's also very important that our patient Bob here is perfectly sedated. A good way to check is just to move his head around a little bit, but be careful. Now he's properly sedated over there. We can start opening his rib. We can start cutting open the rib cage so that we can access the heart. Now, a good strategy to that is to use a bone saw, not a traditional saw like this, but a electric bone saw. Okay, so we are going to start operation. We need to be, I can't take too long in the operation room because his life depends on me and this documentary. Now, we will cut open these parts of the rib cage and these outer ones, so that it ensures that we can take out the rib cage, set it aside, and put it back. So I will start sawing, and then the excess rib, we usually like to put that in a cup, so a container like that, glass cup. And I'm gonna try to saw this. Okay, we're doing good so far. Okay, now as you can see, there are times where a part of the bone may end up in his chest cavity, but that's okay because we are going to remove his right lung. Now as you can see, his right lung is breathing. As long as he has his left lung, he's not going to lose oxygen. Okay, so as you can see, some of the bone parts end up in his chest cavity, but we will ensure. Now I made a mistake there. I'll just take this part of the bone. Now we have here what's called a sedation syringe. We'll just put that in so that he does not lose any more blood. Okay, so mistakes like that can happen, but that is perfectly normal in this environment. So now that we got this part of the rib cage, we will start with this part. Not this one, but this one, so that it ensures that there is still a big part of the rib cage that can take as much time to regenerate. I'll put a hand here so that when we cut open his rib, it does not fall into his chest cavity. We'll just make sure that we don't cut ourselves, which is also an important part. Okay, So a bone ended up there. That should be fine. It's just a little piece of bone that could, over time, decompose inside of his body. We'll take this. Good. Okay. Good, good. Last piece. Okay. Now as you can see, we got a big part of his rib cage. We'll set that aside. We'll set the rib cage aside. We'll get the excess bone that ended up on his esophagus. Okay. Now what we'll do is we'll have to take his right lung out. Okay, so it's also important to monitor his blood level, which seems good. He's not losing blood. Now, as you can see, we can see his chest cavity fully open. Now we'll take the right lung. We'll have to rip it out quickly, we'll have to rip it out very slowly. Be delicate with the lungs, because we're gonna put this back and make sure to reattach everything. So let's see. We'll just grab it with both hands. Okay. We got the lung. Okay. Let's put the lung on a tray like this. That's good. Now as you can see, we can finally access some of the parts of the bone that got in his chest cavity. So we can take that and that, and that's good. It's all clean. Now we'll put the rib next to the lung so that all of our stuff is organized. Now for the heart. So there's still a little bit of blood pumping in his heart, but that should be fine. We'll have to cut all of the tubes connecting to his heart. So if you can see the heart, he has this tube, this. There's 4 tubes in the human heart. And a good way to cut those is by using a thin scalpel like this. So it's very pointy. This has already been sharpened. Now be very gentle. Do not touch any part of the body. So as you can see, I cut that open. Okay. Cut this one open. There's a little bit of blood coming out. And there you go. Set this aside. Now as you can see, this is a good situation because I took out the heart and you didn't see any blood coming out of the tubes, which is fortunate for me. Sometimes that could happen, but just don't panic, but be quick as possible. Okay, now I'll be quick. I have to place the heart carefully in a container like that. Now it's not completely necessary since the heart will be thrown in the trash. Okay, he's losing a bit of some blood from the pump, so we'll just have to inject. So as you can see, he's losing 1 milliliter per second, and that's okay. We just have to inject the part that we cut open, and as you can see, he starts bleeding. He stops bleeding. Okay, let me adjust this. So I can see everything is good. This is very good. Now we take our new fresh heart, carefully open, grab it by this hand, and now we should be able to connect the tubes of the heart. So it's important what you carefully place the heart in the chest. Okay, and then make sure not to accidentally touch the other organs like the liver. It can be very delicate. Now this actually gives us a little bit of room to take out potentially the other bone that fell into his chest. I guess not. I guess it will decompose over time, but now that the heart's in the chest, we can carefully connect the tubes back in their places. Okay, and now we can start going in reverse. So take the right lung, let's put it back in. Careful now. Okay, now take our rib cage. I dropped the rib cage, however, that should be okay since his rib cage is very strong. It is made of bone, after all. And now we put the rib cage back in its place. Carefully now. The lung can sometimes get in the way, but if you just have enough patience, it will come to light. Now that everything is in place, this should regenerate and grow back to what it was before. So we have saved Bob, we have changed his heart, and that is this heart transplant. Now, we'll be fast traveling to our next transplant. So this is a few months later in the documentary. This is the kidney transplant. So this should be much easier than the heart. It's less delicate, but still be very careful. I have arrived at the operating table. We are going to perform a kidney transplant. Both kidney transplant on Jared over here. So our first thing, again, let's make sure that the patient is properly sedated. So again, you can check this by moving his head a bit. Make sure he doesn't wake up. Take the lights, place it somewhere where you can clearly see the intestinal tract. Good. Okay, now as you can see, here is his entire intestines. Okay, this is a small intestine, as you can clearly see. This is the large intestine. We need to take out the large intestine so that we have room to take out the smaller intestine, because his kidneys is underneath all of those intestinal tracts. So what we need to do is grab a big scalpel like this for the large intestine. Now be very delicate in this process. Just make sure you feel the vibrations. And now you can see it getting loose. That's good. So what we're doing, this is the strategy is that we are cutting the start and end tracks of the intestines so that we can fully take everything out with only a minimum of 2 cuts. So that's what we're doing with the large intestine at this very moment. We just have to be very careful. Okay, now that the large intestine has loosened up, we need to be very careful in taking out the intestines. We'll actually be using this tray to put the intestine in. So grab it with, it's preferably good to grab it with both hands like this. place it onto the tray, so the tray will keep all of these organs fresh. Okay, now that we got the large intestine, we'll take the small intestine with a tiny scalpel like this. So we'll just carefully cut that open. Again, this is the end of his intestine, and here is the start, which is connected to his stomach. Now we'll just cut that open. Okay, good. Okay. Now we'll take his small intestines, we'll place it in the same tray as the large intestine. Nice and snuggly like that. Okay? And now you can see his 2 kidneys a lot better. Now you could remove the stomach, but it's very much not recommended. There has been successful surgeries, but I really highly recommend to keep the stomach intact, especially the liver. We cannot remove the liver because it is very delicate. Okay, now I'll just move the part of the large intestine inside. So as you can see, this is where the kidneys connect. Now what we need to do is get a scalpel like this. So not too thin, but a little bit thicker than the one we use to take out the small intestine. Okay, grab it like this. And now we'll make sure we cut open the kidney without cut the kidney connector without hurting any other organs. It's also important that we only take one kidney out, put the new one in, and then take the other one, because he cannot have 0 kidneys in even for a second, because when he starts secreting urine, it's all gonna go in his intestinal tract, which will be bad because urine has acid, which will be bad for the body itself. So we'll just cut open the there you go, you can see the kidney go loose. Now we're gonna take the old kidney. Now this one is basically just a non-functional kidney. We can place it in that one, but we're gonna take our new kidney. Okay, we'll carefully grab just one, put this back down to ensure the other kidney is fresh. Now we'll place the new kidney carefully in there. That's good. That's good. Now we can connect it using the tweezers. So we can connect the kidney back in there. Now this part should be easy. There you go. It's connected. Now we'll take this one will be hard, but we'll take our scalpel again. Now for the left kidney, we need to make sure not to accidentally cut a part of his stomach, because it will be bad. This one can be in a very odd angle. Oh God. Okay, there you go. Now you can see his kidney loosen up. That's good. His liver moved a little bit, but as long as it's still in its place, as you can see, I'm moving the liver. It's still locked in its pivot point. Now let's take the left kidney, carefully extract it. Okay. Let's put it in another container, and I will quickly. Now he's losing one milliliter of blood. We'll just inject the part that we touched. Right there. There. Okay. He's not losing blood anymore. Now let's carefully take out the new kidney. Okay. So this is completely fresh. We need to hurry up so that the to ensure the kidney doesn't to ensure the kidney stays fresh. Okay. Okay, so both kidneys are in place. We'll need to connect the other kidney now. This one should be easier. So like that. That's good. That's good. Now both kidneys are connected. We can now place back the intestines. So we'll start with the small intestine. This one was the bottom intestine. Place it exactly where we left it. Okay. So it should be connected now. Okay. Now we'll take our large intestine. Can be very slippery. Okay. So it's good to hold it from the middle. Okay. We'll connect it back. Just be very careful not to accidentally puncture a part of the intestine. Okay, there you go. So we finished the kidney surgery, and now all of his he has his new kidneys. He has all of his intestines back. Nothing was lost. And that's an A+ surgery. This has been Henry A. Ventricle. Thank you for watching the POV surgery documentary. And have safe operations.